Welcome back to Philippines Uncut. I'm Buddy Kunana. Tonight's topic is alternative remedies for heart disease. And joining us still are Mr. Rommel Santos and Dr. Angelita Teresa of the Integrated Laser and Complementary Medicine Center. Now, welcome back, Rommel and Doctora. Let's pick up from where we stopped earlier. We were talking about diagnosis, and you mentioned a lot of things. You mentioned looking at nails, looking at the tongue, the hair. Why is that? I mean, how can you know a person, what a person's well-being is by looking at someone's nails? I mean, I'm looking at your nails. Like, they look like mine. I mean, right? So how can you do this?
Well, I think from my several years of studies, I think it's because the body, when there's a disorder inside, it is the body's way of calling the owner's attention or the practitioner's attention to that particular disorder by presenting itself exteriorly or superficially. Because sometimes, even if you're aching inside, but you tend to just ignore it, right? But once there's something wrong that is, superficially located or very visible, then you'll give it some attention.
This sounds like a very Chinese or parang Eastern way of diagnosis. Yeah. Because, I was in Beijing a few years ago, and I went to as part of the tour, traditional Chinese medicine, and they look at the pulse, they look at your tongue, and automatically, this is before I went on my diet, they would tell me I have fatty liver, all that, blah, blah, blah.
I also studied the pulse diagnosis, but then I believe the nail and the tongue, plus the face and body marks, they're enough for me. Because with the pulse diagnosis, like, you really have to concentrate, and it's quite variable.
Yes. Now, Doctor, I have a question, okay? What is now you are a Western trained medical doctor. What is the reaction of your colleagues when Western doctors, again, blood test, treadmill, the usual tools. Now when you tell them these things about the nail, the tongue,
well, of course.
What is the reaction?
The common reaction was, keep their distance and somewhat be skeptical about it.
Eyebrow-raising.
But I would say that it's more of the fear of the unknown, because they don't know what I've studied.
Yes. And
but I believe, like any well-meaning doctor is willing to explore whatever avenues are available in order to better diagnose their clients. And these diagnostic measures that I'm referring to are safer, more reliable, and cost-effective for the patients.
Yes.
So and then a few months after, they tried sending their parents to me, and then when they noticed that they all improved a lot, that's when they started referring other people to me, and even themselves.
I'm glad you brought it up. Rommel, let's talk about now success rate. Now, you guys have been around for 2 years. Your Cebu clinic center has been up for 2 years. How about your Manila office? How long has it been up and running?
2 weeks.
Oh, so it's new in Manila. So you really started in Cebu.
We first started in Cebu, yes.
Because why Cebu? Are you from Cebu?
My father's from Cebu.
Okay.
The very first, when I first started, I run it's like a symposium.
Yeah.
There's over 50 or 80 doctors have attended on that symposium. Out of those 80, there's only 3 left. And all those 3 left doctors are the ones that have worked with us on researching, developing the different types of protocol we can use in conjunction with the current modalities that they use.
Yeah.
In our clinic, we have a very high success rate with regards to cardiovascular disease.
Wow. Okay.
Cardiovascular.
Before we talk about that, we have now the machine in front of us.
Yes.
Maybe we can explain to the audience what this contraption is in front of us and what are the different implements aside from the machine we have on the table.
Well, this is the intravenous laser therapy device. Okay, this is.
Looks like a fax machine.
Yeah, it looks. It's actually smaller than a fax machine, but it can save you, if not hundreds of thousands, millions. Well, designed, developed, I won't say invented in Russia. Now, it's now here available in the Philippines specifically, or exclusively in our clinic.
Okay.
Now, there's only a few functions in this. Once you turn the machine on, you have to, this is what we call the radiation emitting probe.
Okay.
What it is this is where we connect
The needle.
the needle.
The IV.
We call it we call this a fiber optic,
Optic
needle.
Right.
Okay.
Right.
So from here you set all your parameters like the output power, the nanometer or the wavelength,
All right.
the time on how long you're going to use the machine, or sorry, the radiating machine for. So from here, it'll power up this radiating emitting device,
Yeah.
which is attached to the which the needle is attached to this. So
fiber optic needle, yeah.
the fiber optic needle. So
And then you put this into the
intravenously
into
through
Now,
the cephalic veins.
Rommel, it looks like a big needle. You don't put that whole thing in the arm, do you?
No.
No.
Just the hole.
Just the whole-
just the tip. The very
enough
Just the tip.
enough to get into the
vein.
to the vein
and shoot the light or the laser.
and shoot the
Yes.
light in there.
You're right.
Okay. No, because we're explaining this because in the next segment, in a few minutes, we have a volunteer, Mel Dizon,
Yeah.
who has bravely volunteered to be here and
Brave
to
enough.
undergo on air sample treatment.
Yes.
You're
of,
sure she wasn't coerced?
A shield trooper. So wait, let's talk about success rate. What is
We-
your success
we
rate when it
volunteered
comes to
her.
treating cardiovascular cases?
We
Coronary.
it's rare to give a percentage because we've only treated a handful of people.
Okay.
Okay, these people have been to the specialist specifically, and they've
By
been
specialist, you mean Western
cardiologist,
doctor?
yeah, Western, yeah,
Cardiologist.
cardiologist, yeah.
Alright.
And most of them have been advised to be prepared or been suggested to, like, go on bypass,
or angioplasty.
angioplasty.
Right.
A few of our patients have actually accepted the
That they're going to do it.
They're going to do it, yes. But we have a few patients that, like, yes, I'll accept to go under that, but hang on, there is a solution that I have been informed of by another, most of them are from, like church or friends. So they come to our clinic in Cebu and they see they see our medical director, Dr. Del Binuya, and it's exactly the same concept as what Dr. Angeli has been doing, is not to tell patient what they already have. It's about educating patient of what they can be after the treatment. Because the doctors, they already know what's actually wrong with them, and
Yeah.
they already knew what they're going or they have to do
Yeah.
to get better.
You're
But
just presenting them with an option.
with another solution. And all of these patients, and like all of these patients that we've seen, I can't remember anyone that have actually failed.
Okay, let's talk about that. Because Rommel said that there are some patients who came and they were already advised by the doctor, the
Yes.
cardiologist, you have to have an angioplasty or a bypass, and you need this. And they actually went to your center and they underwent this treatment. And I mean, what happened? Were they cleared?
Well, most of them, if not all of them,
Yeah.
3 months after they'll have to redo their diagnostic
Okay.
evaluation. Like
Yes.
they have to go the 2D echo again. And because I'm not a doctor, I don't know what other
Yes.
tests
Yeah.
they do.
Yeah.
Majority of them come back clear with the 2D echo.
As in,
Compare apple to apple. This one you have a problem.
and the blockages were gone.
They can't see the blockages.
They can't see the blockages.
I can remember
Imagine
one
that.
of the patients' doctor said,
Whatever you're doing.
whatever you're doing, just keep doing it.
Imagine that. So these patients about to take
one-
either bypass or angioplasty went to you guys, and then after treatment, they went back and they had themselves checked again
Yes.
through the 2D echo and it came out clear.
Yeah,
Yeah.
and to spice it all, he's a ship captain. Like, those big cargo ship.
Yes.
And apparently he can't get his seafarer's competency something certificate unless he passed the medical.
Clearance.
And we have a few of them.
Yeah.
Not just one, not just 10. We have a few of them.
How long are the treatments? I mean, like how long are how many sessions does a person usually need?
For the cardiovascular,
for the
it's about
cardiovascular.
8 to 10, maximum of 10.
Yeah,
Maximum.
8 to 10, maximum of 10, and how long per session?
20 to 30 minutes.
That's it.
Yes.
So they just go to the center, they sit down, they're comfortable,
Yeah.
they can
They
you
can
read,
watch the TV,
they
they
watch
can
TV,
read,
and then
they can sleep.
is there any
take a nap.
sensation here? I mean, is there any pain? Is there any aside from the
Well, most of
initial-
them most of them fall asleep.
So you just there.
That's why that I don't know, maybe because our center is very comfortable,
Yes.
or it's just the effect of the machine, and we don't want to speculate. So, but the patient, on the first 24 hours, based on historical data that we have on all our patients, the improvement that they always say is they have more energy, or they felt energized. They don't feel a lot of chest tightness, and they sleep well.
Energized but calm.
Energized but calm. Yes, exactly.
Not the hyper.
Yeah.
Not
like
the hyper
renewed,
energized.
Like
no.
a feeling of renewal.
Rejuvenated.
Rejuvenated.
Yes.
Amazing. Now, you guys have been in Cebu for 2 years already. How has the reception been in Cebu? I mean, how is business doing? Are you guys getting more and more patients?
Well, on our initial year, we offer this to people to come, we offer the treatment to people for next to nothing. Like, come in, we'll treat you. We just want to take, we just want to record data. Now that we've opened commercially, we don't advertise. All we have is a brochure, an information brochure to give to the patient.
All word of mouth? No,
all word of
No
mouth.
advertisement.
We're relying on people bringing in referrals to us, yes.
Yes, that's amazing, huh? Amazing. How much do you guys charge, if you don't mind me asking?
We charge an average of 2,000 pesos per session.
Per session. And
Per
instead,
session.
for heart problems, 8 to 10, so 2,000 each.
Yeah.
That's 20,000.
Yeah,
Average
compared to
16 to
your
20.
other
Compared to
procedures.
angioplasty,
That's why I'm
an
telling you it's
angiogram, and then an
cost-effective.
angioplasty,
Yes,
and then,
yes.
God forbid, a heart bypass.
Well, we don't mind them giving us a tip once they've saved,
Yeah.
over 1 million pesos for them.
Okay. Rommel, we have about 2 minutes to break. Do you have any words for the audience?
Yes. Well, it's a document coming from the Department of Health that cardiovascular disease is still the #1 silent killer here in the Philippines. It affects not just yourself, but your family, your children, your livelihood, everything once you suffered, the unforeseen. Our clinics are located, one in Cebu, which is the very first one, and we have now opened in
Medical Plaza.
I think they're going to flash the details
Yes.
On the screen. You have the telephone numbers.
We're not saying that we're the best. However, if you're after a solution in Cebu, please do call us on 032 418 416.
4604.
That's the one, and 032 254 1844, or in our Ortigas branch on 02477 0844 or 02 631 7821.
Excellent.
It's always best to have a solution.
Sure, and what we're presenting to people now, we're not saying that, that this thing is 100%, but we're saying this is an option.
This
Yes.
is an option.
Open your mind, open your eyes to what you can do, that you don't need to go via bypass or angioplasty straight away. You can explore this option.
There's an effective and cost-effective option,
Excellent,
I
excellent.
believe.
Now, we're going to bid goodbye to Rommel because we have Mel who's volunteered to have a treatment here in the studio coming. So thank you very much, Rommel. More
Thank you
power
for
to you.
having us
No,
here.
for sure.
And,
And we'll be covering what you guys are doing in your Ortigas branch in the weeks and months to come.
oh yes, please.
Thank you very much. So guys, stay tuned because more of Philippines Uncut and alternative remedies for heart problems and an on-studio live demonstration of this machine when Philippines Uncut returns. Welcome back to Philippines Uncut. I'm Buddy Kunana. Tonight's topic is alternative remedies for heart disease. And joining us still are Mr. Rommel Santos and Dr. Angelita Teresa of the Integrated Laser and Complementary Medicine Center. Now, welcome back, Rommel and Doctora. Let's pick up from where we stopped earlier. We were talking about diagnosis, and you mentioned a lot of things. You mentioned looking at nail.
Because sometimes, even if you're aching inside, but you tend to just ignore it. right? But once there's something wrong that is, superficially located or very visible, then you'll give it some attention.
This sounds like a very Chinese or parang Eastern way of diagnosis.
Yeah.
Because, I was in Beijing a few years ago, looking at the tongue, the hair. Why is that? I mean, how can you know a person, what a person's well-being is? By looking at someone's nails. I mean, I'm looking at your nails. I can't, they look like mine. I mean, right? So how can you do this?
Well, I think from my several years of studies, I think it's because the body, when there's a disorder inside, it is the body's way of calling the owner's attention or the practitioner's attention to that particular disorder by presenting itself exteriorly or superficially.